Good morning, Ma'am Ho. My name is Michael Angelo Mendez. I am a second year student of the Bachelor of Science in Nursing from the Broken Shore College of Davao. So I will be providing a return demonstration on perineal care for male and female clients, and later on we will also do perineal shaving. So the definition of perineal care is that it's a procedure which is done to cleanse or to provide hygiene for the genital area of the client. And usually we do that to reduce the spread of infection, also to provide comfort, and it's actually part of the daily bed bath. And most of the time, we also do that, particularly for clients who will undergo surgery in the genital area, specifically for women who will undergo childbirth. And sometimes for the management of incontinence and also for clients who will undergo catheterization. So what are the reason why we need to do perineal care? As I have mentioned before, we need to provide comfort and hygiene to the client. We also do that to reduce the spread of microorganisms. So at this point, I will show you what are the different materials and equipment that we will need in order for us to carry out perineal care. So we will be needing surgical gloves as part of our infection control procedure. We'll also need a bath blanket. We need a washcloth, but we will just assume this is a washcloth, but this is actually a tissue paper. We'll need a waste receptacle and a bedpan. We'll just assume that this is a bedpan because we don't have bedpan as of the moment. We need a bath blanket. No, this is the bed linen and bath towel. Okay, and we need a container so that we can put our cotton balls later on. We'll also need two types of cotton balls, the cotton ball which is dry and cotton ball soaked in soap sud solution or any antiseptic solution. And last but not the least, we'll need two types of forceps. One is the pickup forcep and the other one is the working forcep. All right, so before we begin, it's very important that we practice infection control. So we need to do medical hand washing and also put on gloves. Now, the rationale for this is to limit or to prevent the spread of microorganisms. So as you can see, I already have donned my surgical gloves and made sure that it is sterile. Okay, and the next step that we will do is to identify the patient. Ma'am, ayong buntag ma'am, ako si Mike Mendez, ako yung mga student nurse. So, naako karon diri ma'am kay maglimpyo sa imong kinatawo, mag-perform ko og perineal washing or perineal care. So, kini siya ma'am importante para dili ta ma-infection. Okay lang ba? Okay, thank you ma'am. Pakita ko sa imong name tag ma'am. Okay, so ikaw si Lucia Perez, no? Okay, thank you ma'am. Okay, so it's very important to introduce ourselves to the client and also to state our purpose and the reason for the procedure. This way, we can gain the cooperation of the client. It also allies their fears and their anxiety, and it helps them feel comfortable while you do the procedure. All right, so we also need to establish privacy by pulling the curtains in so that the client will feel that it is indeed a very private procedure and there's nobody that can see the client except for you and the patient. So the first procedure is to drape the patient, exposing only the part to be cleansed. So if a patient is wearing a patient gown, make sure that we will fold it upwards. And if a patient is under a blanket, what we will do is that we cover the patient with a blanket and making a triangular shape, we need to pull the base of the blanket up, exposing the genital part of the client. And what we will do with the two ends of the base, we will use this to drape to the legs of the client. So let's assume that the client is on a back lying position and comfortable. We need to instruct the client to spread her legs apart and also to just relax, okay? So once the linen is now draped onto the client's legs and her genital area is already exposed or the perineal area is already exposed, we need to insert the bedpan properly. So let's assume that this is the bedpan. Okay, so we've already ensured to fold the gown up above the genital using the top sheet of the linen and to the triangular shape so that the base of the linen is placed above the knee of the patient. What we will do next is to get 7 cotton balls soaked in soap sud solution. Okay, so we have a container here. We will get 7 cotton balls. 1, 2, 3, 4, 5, 6, 7. So this is the cotton ball draped in soap sud solution, and this is our pickup forceps. So our pickup forceps, we will put that back to our container. We will use another forceps later on, which is the working forceps, once we are already doing the perineal care. Okay, using a pitcher, we will pour sterile water, a small amount of sterile water over the client's perineal area. So let's assume that we have already poured over sterile water onto the client's perineal area. So ma'am, ako siyang hugasan ma'am ha. Don't worry ma'am, kaya ang temperature anong tubig is ano lang man, makaya naman siya. Okay, so with our working forceps, you can now start cleaning the genital area or the perineal area using the 7 strokes and using the 7 cotton balls soaked in soap sud solution. So the 7 stroke is from mons pubis down to the labia, down to the perineal area of the client, down to the anus, and then get your waste receptacle and then discard. Okay, you get another one, and then from the mons pubis to the labia minora down to the rectal area, and then discard. You get another one from the mons pubis to the labia minora of the other side of the client down to the rectal area, and then you discard. So that's our third step. For our fourth step, it's from the mons pubis down to the labia majora, down to the rectal, and then discard. And then repeat that procedure for the fifth cotton ball on the other side of the client. So it's from the mons pubis to the labia majora, down to the rectal area, and then discard the cotton ball. Okay, for the sixth cotton ball, cleanse the thighs and the groin area, so which is here. Okay, down, and then discard. And repeat the procedure for the 7th cotton ball, but onto the other side of the client. So it's the groin area, down to the inner thighs, down, and then discard the cotton ball. Okay, we'll also do that with another set of cotton balls, but this time it's with the dry cotton balls. So I will get our pickup forceps again and get 7 dry cotton balls. 3, 4, 5, 6, 7. Okay, so back with our working forceps. It's now time to dry the genital or the perineal area using the same strokes. So from the mons pubis to the center, down to the rectal area, and then discard. Go get another cotton ball. From the mons pubis to the labia minora, and then down to the rectal area, and then discard. And then from the mons pubis to the labia minora, down to the rectal area, discard. For the fourth cotton ball, from the mons pubis down to the labia majora, down to the rectal area, and then discard. For the fifth one, do the exact step but on the opposite side. So it's mons pubis, labia majora, down to the rectal area, and then discard. And then sixth cotton ball is from the groin area down to the inner thigh, and then discard. And the last cotton ball is the same step but onto the other side, from the groin area down to the inner thigh, down to the rectal area, and then discard. Alright, so we need to remove the waste receptacle, and we need to pat dry. You can use washcloth or tissue. Oh no, I mean washcloth, or in our case it's paper cloth. And make sure that you are not repeating the same part of the tissue, so use another edge. Okay, once that is dry, remove the bedpan and do aftercare. And then clean further if necessary. Okay, so at this point, you can help the client insert any diaper or any underwear, and then bring down the lab gown of the patient's gown of the client, and also the blanket. So position the client well so that the client is comfortable, and you can also change the linen. Position the client in a comfortable position. Raise the side rails up to provide safety measure, and then discard everything. Do proper aftercare and discard all the necessary materials that should be discarded, including your surgical gloves and the used cotton balls. I forgot to mention that before you start the procedure proper, you have to do an initial assessment. So take note of any discoloration, inflammation, or any signs of irritation, redness, or swelling. If there is any foul discharge or any discharges like smegma, so you need to take note of that. You need to inspect and any excoriation. Because once you note that there are any findings like that, you have to inform the doctor immediately because this could be a sign of a deeper pathology. So you need to notify the attending physician immediately. So at this point, we'll be performing perineal care for the male client. Now, for the male perineal care, these are the things that we will be needing. We will need washcloth. So let's say, for example, these are our washcloths. We'll also need a basin filled with warm water. The temperature should be 43 to 46 degrees Celsius, which is 110 to 115 degrees Fahrenheit. So let's say, for example, this is our basin with warm water. Okay, we also need the soap sud solution and waste receptacle. This is our waste receptacle. And the pair of sterile gloves so that this is part of our infection control procedure and to make sure that we limit the spread of microorganisms. Just like what we did with the female perineal care, again, we need to introduce ourselves to the client and we need to identify the client so that we make sure that we are doing the procedure to the correct client. And we also need to explain what we're going to do. This will provide safety, feelings of assurance to them and to gain their cooperation and to remove any fears or any anxiety that the client may feel. And we need to draw the curtains in so to provide privacy to the client. All right? So let's say for example, this is our client, sir. Maayong buntag. Ako si Michael Mendez, ang imong student nurse. Ana ako karon sir para mag perineal care or maglimpyo sa imong kinatawo. So kanin siya sir, buhaton nato para dili ka ma-infection, okay? Is that okay? Alright, so sir, tanaw na ko imong name band, okay ra? Alright, so ikaw si Mariano Lopez. Okay, thank you sir. Alright, so once you have introduced yourself to the client, make sure that as usual, you have already done your medical hand washing, and after that, you remove the gloves. Again, the reason for this is to limit or to reduce or prevent the spread of microorganism. Okay, so once you have already provided privacy, you've already explained the procedure and introduced yourself and identified the correct client, what you can do is position the client. So for the male client, the position should be supine, the knees slightly flexed, and the hips rotated externally. And also, you need to make sure that you do inspection. So for our inspection, just like in the female perineal care, you need to inspect or you need to assess any signs of this inflammation, excoriation, any signs of swelling, redness. You also need to take note of any foul discharge, any odor, and if there are any discoloration or any discharges, just like smegma, especially in the orifices. And for our male client particularly, we need to check the folds of the scrotum because usually that is where the bacteria festers and grow. So we need to make sure that it is documented properly and report immediately to the attending physician if you see any unusual findings. And you also need to be sensitive to the hygiene practices of the client, which may be heavily influenced by his cultural background. Okay, so use gloves, wash and dry the penis using firm strokes. So you need to expose the genital part of the client. Okay, this is make sure that the client's gown is folded upwards and the blanket is also folded upwards so that you expose the perineal part of the client. And you need to put towel, a bath towel, a clean bath towel onto the legs of the client, exposing only the penis of the client. So I don't know if you can see, but we have an illustration here of the client's penis, exposing that. Okay, so what you can do is to wash and dry the penis using firm strokes. So with our basin with water, with warm water, it should be sterile. So we can use washcloth. Let's say, for example, this is our washcloth, and then we soak it with the water and soap salt solution, and then with firm strokes, we need to wash the penis. Okay, so make sure that any waste receptacle is handy so that once you've used the washcloth, you can actually use the other parts of the washcloth that has not yet touched the penis, the other sides, And once it's already used, all of the part of the cloth is used, then you can actually discard it. Okay. So if the client is uncircumcised, one tip that we need to remember is that we can hold the penis and actually retract the skin, the foreskin, or the prepuce, so that we can expose the glans penis clearly. So say for example, the client is uncircumcised. In some cultures, men do not undergo circumcision. So we'll hold the penis firmly to prevent erection, and then retract the foreskin or the prepuce to expose the glans penis, and then wash the the penis or the glans penis using your washcloth, which is soaked with soap salt solution and sterile water. Okay, and then replace the foreskin after cleansing the glans penis, and then gently put back the penis. Okay, you can also instruct the client to move away from you so that the butt or the buttocks is exposed towards you, and then clean between the buttocks. Assist the client to turn into with toilet tissue before washing it. So again, with another washcloth, let's say for example that the client is already facing away from you, exposing the buttock area towards you. So you need to make sure that you wash the butt parts, especially the inner sides, the sides that you cannot see clearly, because usually that's where bacteria can accumulate and moisture can also accumulate. So make sure that it's washed, and also make sure that it is dry. And then position the client back to the supine position. Make sure that the washcloth that you used for cleansing the buttock area will be discarded. Okay, for drying, what we need is the towel that we have here. Make sure that the area is properly dried, especially the folds of the scrotum, the buttock area as well. And then once that's done, you can help the client. You need to put this away because it's already soiled, and assist the client in wearing his or her clean pair of underwear. And if the client does not have underwear but instead wears a diaper, you should assist the client as well. And then you may change the linen. Make sure that the client is comfortable and dry. That's after you've dried the area well. Do aftercare such as removing the gloves. So we need to remove the gloves as well because it's already contaminated, and we need to discard it properly. And then we also need to do hand washing to prevent the spread of microorganism. Okay, so one thing that we need to remember is that we need to check back with the client how he is feeling. So sir, kumusta imong paminaw sir? Are you comfortable? Do you feel any pain? Okay. Do you feel comfort? Okay. Okay, and one important step that we need to do after is to document any findings. So if you have any unusual findings such as discoloration, inflammation, signs of infection, swelling, redness, if there is any odor, excoriation, you need to document that. And again, you need to inform the attending physician because that could be a sign of a pathology of something else. And you need to report immediately so that the physician can do further in-depth assessment. So that's it for the perineal care for both male and female clients. We'll now proceed with the perineal shaving. Thank you.